This is an ultrasound of the scrotum of a 27 years old male. Now he is not tender to the probe, no history of pain, trauma, temperature, he is not toxic, and this is the left testis that I am showing you, and you can see the microcalcifications. How many it's full of calcifications, tiny particles, starry, like this, like this. All wherever you see the microcalcifications. Now the testis by itself shows inhomogeneous appearance, heterogeneous rather. Somewhere it is echogenic. Here, as you see, this patch, this area is echogenic with internal tiny calcifications, and this area is relatively hypoechoic, and this is even further hypoechoic. So the echogenicity is not homogeneous, and this is a magnified view. Let's show you the now this is the whole of the testis with small amount of fluid seen along its lateral border. This is the fluid, and this is the transverse section, and you will see a rim of echogenic rim, almost symmetrical, measuring approximately 3 millimeter. Now this is covering the testis all along its outer and posterior surface. As you can see, this is the band of approximately 3 millimeter that is covering this testis. This is the epididymis, this area, and the epididymis is clear. No pathology seen relating to the epididymis. Small amount of fluid is seen. This is the epididymis. This area is epididymis. Small amount of fluid is seen. And then here comes the testis. Now this is a magnified view again, just to show you an evenly echogenic thin rim of approximately 3 mm surrounding the parenchyma of all of the testes. This area, this echogenic rim, you will see everywhere. Now see the texture of the left testis. There are few cystic areas within it. They are scattered. These are tiny cystic areas. These are tiny calcifications, calcified areas. This is an echogenic patch, heterogeneous echogenic patch along the lateral border. And as I move medially, now showing you the whole of the testis. Now I'm going to give a sweep to the probe. To show you all of it. Now this is a complete sweep I have given. There is no vascularity whatsoever. Again I am going to give a sweep. Excuse me. Here we are. Here is this. I am going to give a full sweep to the transducer. The calcifications are clearly seen. They are microcalcifications. Now, moving ahead, what is the size of this, dimensions of this testis? It cannot be measured in one plan, so I have to use two both sides measure its total length. Here. Now you see it measures in length approximately 5.3 centimeters and measures 3.03 centimeters in length, and this is the echogenic, evenly echogenic band surrounding the parenchyma of the whole of the testis. These are the echogenic patches. These are few echogenic patches, cystic areas, tiny cystic areas. These are cystic areas. The rest all is studded with numerous tiny calcifications. No vascularity is seen within it, and okay, this is the right testis, and the right testis is absolutely normal. Texture-wise, and by all parameters, the mediastinum testis is clearly seen. It's normal, and the mediastinum testis is distorted in case of the left testis. Totally distorted. Here is the mediastinum testis, and I will show you, why this is. See it. This is the mediastinum testis. It's distorted, and from below it makes a slope, and then it moves towards the lateral margin. So this finding is of aggressive nature. Further investigative procedures will have to be adopted in this 27 years old young. Now you see, just compare the echogenicity of the normal testis with that of the diseased one. This is the normal, and this is the left, and see the difference. Yeah. So this is our case of the day. Thank you very much.